to our Facebook Live. I'm Dr. Diana Ramos, California Surgeon General. Today, in honor of Black Maternal Health Week, we are thrilled to welcome two extraordinary women, trailblazers and advocates in their fields, and powerful women whose lived experiences fuel their passion, purpose, and impact. But before I introduce them, I want to remind us that Black Maternal Health Week is a chance to recognize the unique strengths, experiences, and challenges of Black mothers and birthing people across the country. The data is sobering. In California and the US, Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. Most of these deaths are preventable, but together, we can work to improve maternal health outcomes through better access to care, stronger community support, and innovation across our healthcare system. As California Surgeon General, I believe in listening to those closest to the issue, collaborating across sectors, and investing in meaningful, lasting solutions. Because when we support mothers and families, we're strengthening the foundation of our communities. Let's get started. First, I want to welcome Angelina Spicer. Angelina is a stand-up comic, writer, producer, actress, mother, and accidental activist who blends humor and advocacy to spotlight maternal health. She's a viral sensation with over 100 million social media views and has regularly performed on Jimmy Kimmel and Conan. She has received many awards nationally and internationally for her advocacy. Angelina is also the founder of Spicy Moms, an organization committed to ensuring gender equity in health solutions by refining and redefining maternal care. Next, Dr. Kim Gregory. Dr. Gregory is Vice Chair of Women's Healthcare Quality and Performance Improvement in the Department of Obstetrics and Gynecology at Cedars-Sinai. She is the Director and Fellowship Director of the Division of Maternal Fetal Medicine and is the second endowed chairholder of the Helping Hands of Los Angeles Miriam Jacobs Chair in Maternal Fetal Medicine. She has served on numerous regional and national advisory boards and committees, such as NIH, U.S. Preventive Task Force, and the Women's Preventive Service Initiative. Thank you both for being here. You are amazing leaders, as you heard from the brief introduction. Let's get started with the first question, and this is for both of you. And whoever wants to start first, go for it. But the first question is, please share your experience with the healthcare system, either personally or through a loved one, and how that shaped how you think about Black women's health and overall healthcare in general. Who wants to go first?
I will. I noticed that, I always start by sharing that when I got pregnant, it was on purpose. My husband and I were married for 6 years. We planned our pregnancy. We had a continuum of care with the same OBGYN, and we were intentional about the choices we made as it pertained to giving birth here in Los Angeles. And what we noticed soon into my pregnancy at around 30 weeks, I was marked high risk, and there was very little education provided to us about what that really meant. At that moment, we felt like we were ignored. We felt threatened, and we didn't feel supported in the way that we had hoped. And that pretty much continued from 30 weeks until we delivered and until I was diagnosed with severe postpartum depression and anxiety. Luckily, thankfully, I had a therapist who was truly plugged in, who really listened to me and both my husband and supported us. So what we learned, and what I learned personally through that experience of that diagnosis and ultimate hospitalization of postpartum depression and anxiety, was that moms really do need support. We really do need to be educated by the professional in the room, even if, these things are procedural, and even if, something as small, seemingly small to a physician, to a mom and to a patient, it can really feel overwhelming. And that guidance and that sort of care and information is needed from the professional in the room. And so as I advocated for myself and now for other moms, I really do push that moms are being educated and supported by their physicians.
So true. Education is key and foundational in order to be able to make the right decisions for yourself. Dr. Gregory, any thoughts?
Yeah, I think that story is a great segue for my position, which is advocate. My story is actually about my brother, and I may have shared this story once before, but he experienced unexpected acute kidney failure at a young age, and it was attributed to chronic hypertension. And I knew he didn't have chronic hypertension, and despite the fact that I was a doctor, I couldn't get anyone to listen to me to do a more thorough workup. And so I called a friend who happened to be a pediatric nephrologist. And this was back in the day when we were still using the paper chart. And the two of us sat down and we went through that chart and we did all this literature review. And we were able to find some case series to explain what his problem was. And from that, we were able to advocate to actually get him dialysis. And his kidneys completely recovered. But it really made it clear to me that you have to know your medical history. You have to trust your body and your instincts when you're interacting with people within the healthcare system. And then you have to advocate. You have to advocate, advocate, advocate.
Yes, and I'm hearing a common theme is that education and advocacy. And your brother was quite fortunate that you were a physician and knew enough to do that whole literature review. But oftentimes people do not have that family member or that person in their life to help them navigate through that. So yes, education is key, but then advocacy, if you don't have that information saying, no, something's not right, you need to hear me and listen to me.
You need to hear me. That's right.
That's right. Now, both of you are really stellar in your field and what you do in healthcare, entertainment, and comedy, and in advocacy. Can you share, Angelina, a moment where you were called to use your profession to uplift women's health? And it kind of sounds like you started giving us a little bit of insight, but maybe expand into that a little bit more.
Yeah, I was called to use my platform when I was released from the psychiatric facility in Pasadena, when I was originally diagnosed with postpartum depression and anxiety. When I was released, I made a personal commitment to myself and to the women who I knew had experienced the same thing that I had gone through, to use what little platform I had at the Improv Comedy Club in LA to normalize these conversations around how we talk, treat, and even joke about postpartum depression and anxiety. And I bring that every time I hit the stage, be it in a comedy club in Kentucky or here in Los Angeles. I've used my platform really because it's a disarming way to educate folks. And also it in a self-serving way, it helps me heal too. I feel less alone when I share stories about postpartum and what it felt like to give birth and get stitched up, not the glamorous parts of motherhood, but those make for the funniest parts and actually the more relatable parts of motherhood. And since then, also using comedy, but also advocacy, that point also, I was called by a woman on TikTok who made a severe cry out to the public for support because she was feeling overwhelmed by motherhood. She had her 2-week-old baby in her arms. She pled out to TikTok, and about 500 people reached out to me to support her. And We have started to support moms all over the country with small donations and fierce advocacy. So that's really how my platform has come to fruition, and been to used to support moms through my organization, Spicy Moms.
And you are so gifted. I've had the honor and the pleasure of seeing you perform and come away so inspired. So yes, absolutely encourage folks to look up your videos on YouTube. And really, it's a wonderful platform that you are helping normalize and saying it's okay to talk about mental health and postpartum depression.
Sure.
Dr. Gregory, any insights? I mean, you are an amazing and truly, for me, an inspiration when it comes to not only patient care research, but more importantly, advocacy. Can you expand on how you are leveraging that and how you use that your platform? You are at the forefront.
It actually happens every day. So as I see patients, my practice is primarily consultative because I'm a maternal fetal medicine. So I do a lot of ultrasounds and consults for diabetes or high blood pressure or previous problems. And, you're bobbing along in your day and you're just trying to get through patients. And sometimes you walk in the room and you could just tell like they're everyone's anxious and I'm like, okay, I know you're here for an ultrasound, but we actually need to have a conversation, right? And so I walk a fine line, trying to remind women in general, and Black women in particular, that the odds are overwhelmingly in your favor. I mean, we know that bad things happen, but there are 4 million births a year. And so overwhelmingly, the outcome is normal and okay. And just trying to remind them about the joy of that. But at the same time, you don't want to be cavalier, right? And so you want to make sure that if this woman does have a risk, that they're informed about it and that they know what the warning signs are and how to bring those warning signs to the attention of others. So that's how I use my platform, just from a day-to-day, room to room,
Thank you. No, and I will put the plug that through your voice, you really are that voice when it comes to being on advisory committees, whether it's the NIH, the Women's Preventive Service Initiative, the U.S. Preventive Health Task Force, so helping make decisions for the nation. I know you oftentimes will bring the voice of the Black, the brown people who are not oftentimes heard. And thank you for doing that. So I see you using your platform to elevate those priority areas as well. So thank you so much. So now change takes a collective effort, and you've kind of both touched on this. What are some ways that people watching today can take away a collective action, be inspired, one thing that they can do to help support Black maternal health?
Dr. Gregory, I don't know if it's okay. I'm just like ready to pounce on there. I think you're right, Dr. Ramos. Change does take a collective effort. Many times when I was in the pits of postpartum depression and anxiety, I just wish I had a friend. Honestly, I wish I had community. I wish I had another mom who was open and honest with me about her journey. And sometimes I wish that friend had come from my own family, right? But my daughter at her elementary school, they have a buddy bench. And I wish that parks around the city had buddy benches where if you needed a buddy, you could just sit on the bench with your baby and another mom could come up and sit next to you and have a warm conversation. But since we don't have the buddy bench, my takeaway would be for us to create the buddy bench. If and when you see a mom, particularly a new mom with a baby under 12 months old, who's in the grocery store, who's in the pew next to you in church, or in the mosque with you, or even at the park, go up to her, be a friend to her, ask how she's doing, but more than that, it's also nice if you share a little part of your journey with her. Because though she may not feel supported, she may not feel like she has a voice or has yet figured out what's really wrong or what she's experiencing, you sharing what you experienced might unlock something within her that would make her feel seen, appreciated, and a little less alone.
Well, now it's my turn to
Beautiful.
pounce.
Yes.
I feel like that this could not have been more beautifully executed had we planned in advance, because the first thing that came to my mind when I heard that question is 1,000 acts of kindness. That we need to eat right, exercise, and support each other to decrease stress, help with depression, kids. Sometimes, you're at the elevator and you see mom struggling, and I'm like, go ahead. And they look at me like, I'm like, look, I've been here. I know what you're struggling with. And then I agree, share stories and resources. I would not be a doctor today if someone ahead of me didn't tell me what to do, what class to take, what teacher to avoid, how to keep my focus. And we all have to embrace each other and form a network. Each one teach one. I think that those are my take home points, is that if there's an opportunity for you to do something kind for anyone, but particularly for pregnant or recently pregnant mom, do it.
I love it. You both have given a sneak peek to one of our initiatives later on this year, which is one kind thing. So to do one kind thing for a mom. So we're gonna pull you all into this next
Please.
one. And if we can do one kind thing, imagine a whole community for a new mom. It'd be so powerful. So finally, the last question, and in closing us up, I'm coming away so inspired. For somebody listening, what would be one direct message that you would give to them about their health? And is somebody considering to become pregnant or is pregnant right now?
Dr. Gregory, I'm sorry to jump right in, but I'm so energized by the conversation. My hope is that any mom or any woman who is listening and who is either pregnant, considering being pregnant, practicing to be pregnant, think about the postpartum period. We don't talk enough about how long it is. We don't talk about
21 years.
21. Oh, well,
And
man.
then some.
Oh my Lord, my daughter's 9. I got a long way to go.
Enjoy.
Okay, I will enjoy, and I will also continue my Zoloft. I just wish that we spoke more about that 12 months, that critical time period after a woman becomes a mother, and the changes that her body's going through, the changes psychologically that she might be experiencing, the changes in her relationship with her partner, the changes with herself and her baby, right? We always talk about a birth plan. Let's think about what postpartum looks like. And postpartum is a time period. It isn't short for postpartum depression. Postpartum is a time period after you have a baby. So think about that as we consider whether or not we want an epidural, whether or not we want a home birth or a hospital birth or a doula, midwife, or we want to go to the hospital. Let's start to think further beyond once our babies are here with us. That way we can have a realistic idea and expectation, not only of ourselves, but of our relationships around us, including that of with our babies.
I love it.
So I'm going to remember these 2 take-home points from you, and that's the bench buddy and the postpartum plan. Because you're right, we talk about birth plans, but we don't talk about postpartum plans. I think that the message that I would like to leave is that anyone considering pregnancy or already pregnant and thinking about parenthood, the take-home point for me is that you can do this. Eat right, exercise, take your medicine, keep the faith, and remember that your body was exquisitely designed to do this. You can do this.
You make me want to do it again. Dr. Gregory.
I love it. Thank you so much. You are both so inspirational, and I appreciate the time that you have shared with us, the words of wisdom, just highlighting the fact that Black Maternal Health Week should not just be a week, should not just be a day. It should be an everyday event and an everyday observance. So thank you. We're going to walk away with the bench buddies, with the exercise, with the inspiration, and with that postpartum approach, and really improve the health of every mom every day. So thank you so much for your participation. I am forever grateful.